Okay, so we're working with Clarissa. She's having some elbow pain, and she has some pretty straightforward lateral epicondylitis here. So I figured I'd take some time just to talk about this a little bit. So our lateral epicondyle is a spot on our humerus where we get an attachment, which is known as the common extensor tendon. It's a shared tendon by 4 different wrist extensor muscles here. So that's a really common place to get it. Another name for this is tennis elbow. Obviously not all tennis players get it, but you just think of a backhand in tennis, where if we're overworking through here, then we can develop some issue with this. So we're going to do some treatment on this, but I figured I'd talk about it a little bit first. So initially when somebody has a problem here, it's usually inflammatory when they start to get the symptoms initially. But that's only the short term, maybe the first couple weeks. So we may give some recommendations to reduce that inflammation. Ices are usually our go-to for that. But after that couple weeks, and they're starting to still have some of those symptoms hang around, then we're past the inflammatory stage, and we're really looking more at some issues of connective tissue scarring, particularly around that common extensor tendon. So that's not the only place that we treat. We really want to make sure that function-wise, everything is moving as well as it can. So a couple areas that we are concerned about. We're really concerned about anything that can create some movement around the elbow. So we have to look at some rotation here, our supinator muscle, where some people can complain about some soreness here as an issue. So we'll typically do some treatment over there. We talked about the common extensor tendon. We have to treat the muscle bellies themselves. And the reason this becomes a problem just functionally is because the job is to extend that wrist. The wrist is meant to be mobile, but at the elbow, should be our stable point where we can have a lever off of that. So really it starts to become overworked within that. So our treatment of choice is really, once we get to this point where we're starting to get some scarring in the connective tissue, is manual therapy. Active release technique is our go-to choice for this. We may have to use the Graston tool in some cases if we get some of those really hard nodules that just needs a little bit more of that pressure. And then another condition that we do worry about that we keep in mind, the radial nerve, obviously it starts up at our neck. It's going to trace all the way down, and just off to the inside of where that common extensor tendon is, we get the point where the radial nerve has to dip through. And this can become entrapped sometimes, and the entrapment might come up a little bit higher. Entrapment could be right here. I'm at the brachioradialis muscle, which is our hammer curl muscle here. And this can become entrapped, and it can present a lot like lateral epicondylitis. Treatment here doesn't necessarily change. We might give them some additional things, but our go-to choice of manual treatment is usually active release. We got to be able to get that nerve to slide underneath. The radial nerve, it traces right along here as well. Again, we might use the Graston tool to get a little bit of freedom through there as well. But that's really how we attack this. Typically the earlier we catch this, the easier it is to treat. But we have really good success with this. Again, as long as we catch it early, we may have to eliminate some of the things that aggravate it, but we do really well with this. Again, if we catch it early, we get the right diagnosis, and then we get on it with treatment. So I tell you what we'll do is I will put together another video for you guys, and the manual therapy comes early on. Once the pain level starts to come down a little bit, we got to give some active exercises to the patient as well. So I'll put together another video, and I'll show you that as well. So thanks, guys. Appreciate it.